You know, getting back to your life following an injury is a process, and oftentimes that process involves physical therapy.
Yeah, when a doctor orders physical therapy, the patient meets with a therapist to do exercises that ease pain and promote functional movement. The folks at Benchmark Physical Therapy do so much more than help patients recover from injury. In fact, you may be surprised at some of the therapies they do offer, therapies that are delivered with one-on-one personalized care. The relationship between a patient and physical therapist is a vital one, a relationship built on trust. That trust is important at Benchmark Physical Therapy.
So what we try to do differently at Benchmark Physical Therapy is that we try to make it more of a one-on-one sort of care, not the big, busy clinic. Turn that foot forward.
Oh, sorry.
That's all right. There you go.
Tom Gottstein is the clinic director of the Georgetown and Seaford locations. He says patient-focused care is the #1 priority in all treatment plans, and patients aren't rotating from one therapist to the next.
Consistency of care is definitely the biggest benefit there. You're working with the same clinician every visit 2 to 3 times a week for the entirety of your care. So you're working with someone who's very familiar with what your case is, very familiar with how it's progressing, very familiar with what needs to be changed or monitored, stuff like that.
It's that personal approach that drew Ryan Tezak to Benchmark.
The culture really aligned to what I liked, and that one-on-one, that patient care, and there truly is a culture here that is different than a lot of places that we hear about. And it's patients become family, and we spend a lot of time with them in the clinic, and then we keep up with them outside the clinic. And so it's just a very unique relationship that we get to have with our patients.
Feet shoulder width apart and straight up, going down into a squat position. All right.
Patients learn on day one that their treatment plan is a collaborative effort.
I like to set up the standard that it's an open dialogue, that I want you to be an active participant in your plan of care, that I want you to tell me if you feel like something's not going right. If you've done something in the past that helps, I want you to tell me that. If you feel like we're doing something that's not working, I want you to tell me that.
Ryan says it's that communication that is key to patients meeting their goal. Not only communicating the what, but the why.
If the patients can understand and kind of understand our madness, because we do a lot of stuff with them. They're with us for about an hour and 15 minutes each time. And so as long as they can understand what we're doing to them, they really buy in, and that helps their care.
I was going to tell you to come more on an angle backwards, but you're already doing it.
Care that is not limited to recovering from an injury. Benchmark Physical Therapy addresses other issues such as general weakness, vertigo, pelvic floor rehabilitation, and chronic pain, which is sometimes treated with dry needling, something not to be confused with acupuncture.
The difference is where acupuncture is focusing more on like energy flow and centering your chi, stuff like that. Dry needling is focusing more on like soft tissue techniques, finding muscles that have tight spots like taut bands, and actually inserting the needles into those tight spots, looking for like a twitch response to try to release some of that tension in that muscle.
Whether you're young and want to excel in sports or older and just want to keep active and moving, the folks at Benchmark know what it takes to reach your goal.
And that's the nice thing about the population down here. Even though it's a retirement community, people are active later in life. And so our goal is to keep them doing the things that they loved, even though it was 5-10 years ago. We don't really use age as kind of a barrier. We kind of just tell them that our goal is to get you moving as well as you can, and get you either kayaking, is it running, is it walking, is it biking, taking advantage of what we have down here in Southern Delaware.
I'll have you do 5 today. How does that?
And when they do reach that goal, both Ryan and Tom agree there's nothing better.
I think that's the thing that brings me back, and why I love doing what I do every day is 6 weeks down the line, you get to see someone that could barely get into the clinic, and then they're almost running out of the clinic, and they have a smile on their face.
Seeing them hobble in, barely able to walk, and taking them through a plan of care, whether it be 4 weeks, 6 weeks, 8 weeks, whatever it may be. And then on their last day, they're walking out, they've returned to work, they've returned to sports, they've returned to, doing the functional activities they like to do with their families. And that's definitely like the most rewarding part of the job.
And Benchmark Physical Therapy has 4 locations on Delmarva: Georgetown, Millsboro, Milford, and the newest one in Seaford.
That one-on-one care is
It's important.
important.
Yes, absolutely.